Dana, and our group is doing hip osteoarthritis. So to start off, I'd like to tell my patient a little bit about the disease, which is a general degeneration of the joint capsule and the articular surfaces within that hip joint. It can also affect the ligaments, and through this you can get just some general wasting of the muscles and weakness throughout that hip, and it causes a lot of pain. So to start off today, I'd like to start with a functional test, just to try to rule in that it is coming from the hip. So we're going to do the Stinchfield test out of our Dutton test book. So what I'd like you to do is you're going to lift this left leg up to about my hand, a little bit higher. Good. And can you hold that position? Okay, so from here, we very generally apply pressure into extension and ask them to hold the position. All right. Now, a positive sign is a reproduction of their pain. And then where is that pain?
In my hip.
In the hip. So this is a good test to determine if it's low back or hip pain. From there, I'd also like to do a little bit of general joint distraction. So from here, I'm going to wrap the ankle. We're going to cross the mobilization belt here. And the way I like to do traction with the patient, get my hand between the belt and their ankle, and then I'm able to just lean back into the belt. And Lily, how does that feel?
Good.
Good. All right. And we can hold this 2 or 3 times for about a minute each time, just trying to open up some joint space in that hip.
So next we're going to have Lily go ahead and do a seated hamstring stretch. So the hamstring is often a tight muscle for people with osteoarthritis because it is a 2-joint muscle, and since sitting is a comfortable position, sometimes it'll get tight there. So first thing I'm going to have her do is put her left leg out straight and just lean her hips forward until she feels a good stretch behind the leg, and she would hold that for about 30 seconds. And she could do that 2 or 3 times. Awesome. And then for a lower extremity exercise, I'm going to have Lily go ahead and stand up. And I would raise the heel or like put a bolster if she didn't have good balance. But in order to strengthen the flexors, abductors, and extensors, since like David mentioned, there can be muscle wasting, I'm going to have her just standing on one leg, kicking forward, and she would do 2 sets of 8 maybe or 10, and then she would kick out to the side, kicking that toe forward. And then if you step forward a little bit and kick back straight and try not to lean forward too much. Awesome. And we would do it on both sides because standing on one leg will also strengthen the glute med as an abductor on the other leg. And an appropriate regression for this exercise would be to have them lay down on the table and do extension on their stomach, sideline, and then on their back for the flexion.